Hello and welcome to Pregnancy Info. Every pregnant woman dreams of the day she will hold her healthy, smiling baby in her hand. But sometimes during those crucial 9 months, a hidden challenge can appear. The baby's growth inside the womb may not be normal. This is called abnormal fetal growth, and it can be unnoticed until it becomes a serious risk. In this video, we will understand exactly what it means, what warning signs you should never ignore, the main causes behind it, how doctors diagnose it, and what treatments can help ensure your baby's safe arrival into the world. Number 1. Understanding abnormal fetal growth. Abnormal fetal growth means the baby inside the womb is not growing at the expected rate for its stage of development. This can happen in two major ways: intrauterine growth restriction and macrosomia. Number 1. Intrauterine growth restriction, or IUGR. The baby is growing slower than expected and is smaller for its gestational age. Number 2. Macrosomia. The baby is growing too quickly and becomes larger than normal. In both cases, there can be complications. A baby with IUGR may struggle to cope with the stress of labor and may need intensive care after birth. A baby with macrosomia may face delivery injuries, shoulder dystocia, or breathing issues. The growth pattern is usually checked against a standard chart, and any deviation triggers further investigations. Number 2. Signs and symptoms. One of the most challenging part of abnormal fetal growth is that mothers often don't feel obvious symptoms early on. That's why regular prenatal visits are not just a formality, they are your baby's lifeline. However, there are some signs you and your doctor might notice. Number 1. Belly size mismatch. Your belly might look smaller or larger than expected for your pregnancy stage. Doctor measures this using a fundal height measurements, the distance from your pubic bone to the top of your uterus. Reduced fetal movement. If the baby's kicks and movements suddenly decrease in strength or frequency, it can indicate stress or growth issues. Unusual maternal weight changes. Very little weight gain or sudden excessive weight gain can both be warning signals. High blood pressure or swelling. These can be linked to conditions like preeclampsia, which affects the baby's growth. Many times it's during an ultrasound scan that abnormal growth is first detected, so skipping checkups can delay detection. Causes of abnormal fetal growth. Fetal growth depends on three major factors: mother's health, the placenta's function, and the baby's condition. Problem in any of these areas can cause abnormal growth. Number 1. Maternal factors. Poor nutrition or iron deficiency, anemia can limit oxygen and nutrients reaching the baby. Chronic conditions like high blood pressure or heart disease can reduce blood flow to the placenta. Gestational diabetes can lead to excessive sugar in the mother's blood, causing the baby to grow too large. Smoking, alcohol, and certain drugs can directly restrict growth and harm development. Infections such as rubella, CMV, or toxoplasmosis can cause growth restrictions and birth defects. Baby-related issues. Genetic disorders, chromosomal abnormalities like Down syndromes or congenital birth defects can lead to IUGR. Multiple pregnancies like twins or triplets can also limit space and nutrients, affecting growth. How diagnosis is made. Regular monitoring is the key. During each visit, your doctor will measure your belly and compare it to the standard growth chart. If there is a concern, further tests are done. Ultrasound scans. These measures the baby's head, abdomen, and thigh bone length to estimate weight and track growth over time. Doppler's flow studies. A special ultrasound that measures blood flow in the umbilical cord and placenta. Poor blood flow can indicate the baby is not getting enough oxygen. Amniotic fluid assessment. Too little or too much fluid can be linked to growth problems. Non-stress test monitors the baby's heartbeat and movement patterns. Maternal blood tests check for infections, anemia, or underlying health problems affecting growth. This combination of tests help doctors decide whether the baby can safely continue developing in the womb or needs early delivery. Treatment and management. Treatment plans depend on whether the baby is too small or too big and why. If the baby is too small, Improve the mother's nutrition with high-protein, vitamin-rich diet. Treat any underlying conditions like anemia or high blood pressure. Monitor growth with ultrasound every 2 to 3 weeks. In severe cases, hospital observations or early delivery via C-section may be recommended. If the baby is too big, strictly manage blood sugar levels. If the mother has diabetes, avoid excessive calorie intake to prevent further weight gain. Plan the mode of delivery carefully. In many cases, a C-section is safer to avoid complications during birth. In both cases, bed rest, stress reduction, and medical monitoring are vital. Doctors balance the risks of keeping the baby in the womb versus delivering early to ensure the best outcome. Final thoughts. Abnormal fetal growth is not something to panic about, but it's not something to ignore either. Many babies with early growth issues go on to be perfectly healthy, but only if the condition is detected and managed in time. The secret is regular prenatal care, a healthy lifestyle, and being alert to changes in your baby's movement on your own health. Remember, every kick, every heartbeat, every checkup is a step towards meeting your healthy baby. If you find this video useful, must share this information with other pregnant women that they can also get benefit out of it. Thank you.